Please
thing
begin.
like no at school
So it is time. So
Madam, please begin. We are live.
A very good afternoon and Hanumanan greetings to one and all. Here at Parul University, we had started the webinars during the lockdown and we have continued with that practice and we have completed more than 120 webinars till now. For that, we have got a very dynamic team of we four principals of the Constituent College of Parul University. First is Dr. Purav Desai, who is the Dean of Faculty of Homeopathy and the Principal of Jawaharlal Nehru Homeopathic Medical College. Dr. Panda Sir, who is the Principal of Parul Institute of Homeopathy and Research. Dr. Hitat Mehta Sir, who is the Principal of Rajkot Homeopathic Medical College. And myself, Dr. Hina Rawal, the Principal of Ahmedabad Homeopathic Medical College. We have the motivation of our President, Dr. Devanshu Patel Sir, who always keeps on insisting that the webinars, even though the offline classes have started, must continue. So here again, today we are with another webinar, and it gives me immense pleasure that we are bringing the stalwarts of homeopathy from the nation to our students as well as the attendants of the webinar. Now today's speaker, I would like to introduce Madam Dr. Nadab is an MD in Organon and Homeopathic Philosophy from A.M. Sheikh Homeopathic Medical College, Belgavi, affiliated to Rajiv Gandhi Health University, where she stood first and was a gold medalist. She is a MS in Counseling and Psychotherapy. She has done fellowship course in Homeopathic Dermatology. She is a homeopathic consultant since last 20 years. She is also an associate editor for the prestigious National Journal of Homeopathy since 2013. She is a mentor to students of fellowship course in Homeopathic Dermatology since 2018 at Dr. Batra's Academy, Mumbai, affiliated to Maharashtra University of Health Sciences, Nasik. She is the former research coordinator at Dr. A.M. Sheikh Homeopathic Medical College, Belgavi, from 2000 to 2001. She is also the former assistant professor, PG Studies, Department of Organon and Homeopathic Philosophy, Bhartesh Homeopathic Medical College, Belgavi. After her BHMS, Madam worked as a clinical coordinator and chief assistant doctor in Kasbekar Medgood Clinic and in vitro fertilization center, Belgaum, during which she was exposed to advanced management of infertility, which includes fertility counseling, ultrasonography, endoscopy, and ART. Actively participated in CME programs and workshops, and in case presentation during scientific meet conducted in the IVF center. This training and experience has been imperative treating 8 cases of primary and secondary infertility with homeopathy till date at her clinic. After MD, Madam worked as research coordinator in A.M. Sheikh Homeopathic Medical College and conducted a successful study on a prospective study on allergic rhinitis and its homeopathic management, and under the guidance of Central Council of Research for Homeopathy. She worked as a student's representative in the editorial board for the PG Bulletin Inspiration. She had also organized the All India first ever postgraduate scientific seminar, Genesis, at Belgaum. She has presented scientific papers at various seminars, CMEs for the Department of Ayush, Ministry of Health and Family Welfare, Government of India, for Ayush rural doctors, presented a case study on hypothyroidism in NJA, first ever overseas seminar at Dubai. Madam has also presented papers at the Malaysian International Integrated Management of Children with Special Needs at the Cyberjaya University College and Medical Science, Malaysia. She was conferred with the prestigious Vocational Award for her services for betterment of our community by Rotary Club of Belgaum on National Doctors Day, 1st July 2020. It's my pleasure and honor to invite Madam for today's webinar. So please, madam, you can start your webinar, please.
Thank you so much for such a beautiful introduction. Of course, it was a little elongated. Thanks so very much. At the very outset only, I would like to thank the entire Par Universities. First of all, thanking Dr. Hina Rawal, madam, for the introduction and as a principal of Ahmedabad Homeopathic Medical College. Then I would also like to thank Dr. BP Panda, Principal Sir of PIHR, and Dean of Faculty, Dr. Purav Desai, and of course, Principal Dr. Hitarth Mehta for this wonderful invitation, because it's a great opportunity for learning as well as sharing, because when we share, we learn. And so today's topic, I would like to, may I start, ma'am? May I start sharing?
Yes, sure, ma'am. Most welcome, ma'am. Yeah.
Right. 1 second, I just share the screen. So my dear students, it's being an afternoon, but I think we have very good climate back in Gujarat as well as in Belgaum here right now. So I would not like to say that we all are sleepy. In fact, I think because generally I'm in the lighter note, I'm telling you this. When we talk about organon subjects, it tends to make you feel more didactic, or it sometimes sounds very theoretical. But today's topic, okay, I don't think organon is such a subject once you start applying clinically in your practice. But as a student, I remember even we had the same opinion about organon. But today's topic, I'm going to talk upon it's a temperament, okay? And it's assessment in clinical practice. Now, this particular topic is very dear to my heart, and also because it is one of the core factor that we use when we start prescribing our homeopathic treatment. Just 1 second, my screen is not moving. I will just, yeah. So today's topic will be, I hope everybody can view it because it becomes one way. I'm not able to have a direct connect with you.
Yes, madam.
Okay. So basically we will.
Yes, ma'am.
Yeah,
yes, ma'am.
Okay. So today we are talking on a very interesting topic, and that is assessment of temperament and its application in homeopathic prescription. Like I told you, a very interesting topic, very useful in our clinical practice. And I think right from our second year, especially people who are attending, students who are attending your clinical classes should have understanding of what is temperament, because right from second year to final year, of course, we are going to study about temperaments. But then by the time you come to your internship, you should be very well aware how to use temperaments in your homeopathic prescription. So I'll try to make it as simple as possible, because I believe that students from first year to final year all are there. Okay. So at the beginning, I would just like to pay my respects to Dr. Parina Zumranwala, who has done extensive work on temperaments. And fortunately, I have been able to study under her guidance regarding this particular topic in many seminars. So at the very outset, I would just like people to understand, because when we talk about constitution and temperaments, there's a lot of confusion, and both have a very similar, what you call, close relatives of each other, the terms constitution and temperament. And one more, what you call, constituent is your diathesis. So in short, I will just tell you what does constitution mean, what does diathesis mean, and how do we understand temperament, and how temperament can be assessed when a patient walks into your clinic. Okay. So I'm sure all of you know constitution. It comes from the Latin word constituere. It means to form or make up, to appoint, or to being to. The constitution is a natural condition of the body, okay, or of mind, or it's a disposition. It's the inherent nature that we all have. So very much whenever you're taught about case taking, we always insist upon, we all teachers insist that your aim is to be a constitutional have a constitutional prescription, because any chronic disease which can get treated only by constitution. Of course, we do use our acute medicines and acute remedies, phase remedies, your what you call follow well remedies, but the main core of any patient is the constitution. Okay. And there are very little differences between constitution and temperament. You will come to know in the coming slides. Okay. And before that, I would also like you to understand the meaning of diathesis. constitution, diathesis, temperament. This is how you need to understand them. Diathesis is an inborn state, okay, disposing to a disease. For example, uric acid diathesis. A individual, a patient who walks into a clinic with uric acid diathesis will have manifestations like renal calculi. He may have gout. So this person already has a tendency, and with a slight exposure to the environment, it has been triggered off and he lands up into a disease, a group of disease. Okay. So this is the meaning of diathesis. And then, of course, temperament. It is basically a very specific, intense, passionate nature and character of an individual. And this is a very what you call individualistic. Temperament actually is a part of a constitution. Okay. Constitution is a broad term. Temperament is just a part of it. But temperament is again unique to your patient. And that is why it is so important for us homeopaths to understand temperament in its entirety, because then we can prescribe very well, because individualization is one of the strong what you call thing that we take in our what you call prescription, isn't it? So once you understand temperament, you can individualize your patient very nicely. So now you understand, see this flow chart for a better understanding. Constitution has mentals and physicals that we know, right? So in mentals, we have temperament, the mental generals that we take from a patient. When we take the life space of a patient, we go through the mental generals, isn't it? We ask about how the patient has been in childhood, in his teenage, in his early adult age. If he's a little older, any what you call geriatric problems at the mental level, okay, what he has gone through his life. And the second part is the personality, okay? Now, temperament is an inherent quality that you can see in your patient. Personality is what the patient develops in his course of his life, in the journey of his life, okay? Because today I may be a teacher, okay, but in my childhood, I may be having a different persona because my exposure to the environment, okay, was different. My education was different then, okay? As I grow up, I get exposed to the environment and I keep on what you call changing my personality, okay? Like at home, I'm a different person, okay? I have to be a daughter, I have to be a sister maybe, or so many other things. But when I come to my clinic, I'm a doctor. So I behave like a doctor. I have the personality of a doctor in front of my patients, okay? So this entity is changeable, but temperament cannot be changed, okay? And of course, physical generals, I would not like to go into details. It's just for understanding, okay? So we have general physical and diathesis also, what I just described, rheumatic, hemorrhagic, tuberculous, trophilis, lymphatic, all this constitutes a constitution, okay? And today we are going to take one aspect of the constitution, that is temperament. So our temperament takes form according to a genetic material, okay? The mental and the physical temperament. The temperament is a real me, okay? What is a real me? The question which arises in the mind is that how temperament is different from personality, okay? Personality is a dress that one puts on over itself. Like I told you, when I come to my clinic, I'm like a doctor. I have to behave like a doctor. I have to dress up like a doctor, okay? It's a facade, okay, that we portray. We show it outside to the what you call people outside, to the society, okay? The attire and clothes that we wear, how we take care of ourselves, how we talk, how we eat, sit, etc. All this defines personality, okay? Temperament is a very what you call innate thing, okay? It is inborn in you and it remains with you, okay? Like, you know, the personality is what we see, the outer shell of the coconut. For example, if you see a coconut, the person in the bathroom, this is a very good example, even Dr. Parinaz Umranwala gives, and I also like to share this. The person in the bathroom, okay, when I'm in my private, what you call space, that is the real me, or that is a real Mr. X, the patient that is there. And the one portrayed in the boardrooms, for example, this Mr. Real X, okay, he goes out in a boardroom, okay, when he goes to a meeting, when he goes to a public gathering, okay, or for example, if you're a doctor, you come to a clinic, what you portray in the clinic, what you portray in the boardroom is the personality, okay, very easy to understand. What I am to myself, the anger, the frustration, the happiness, the sadness, okay, whatever I express to myself when I'm alone is the temperament. So we are all born with temperament traits, okay? That is a raw material that we are born with, our own base, but personality is something which can be changed. It can be developed or it can be even enhanced, okay? I may not be a very good public speaker when I was maybe in my 10th, 11th and 12th or even my BHMS level. But as I grow ahead in my career, I learn all these things. So I change my personality. I know how to talk. I know how to behave better, okay? So this is the real difference. I hope we all are understanding till here. The personality and the temperament, they look again very similar, but they're two different entity. Very simple. Personality is what we project outside, and temperament is what we are born with. Okay. And temperament cannot be changed. Personality can be enhanced, it can be changed, or it can be developed. So temperaments, why do we need to assess it? You may say, well, we are giving a constitutional remedy. We are going through the totality of symptoms or the portrait of the disease. Why do we need to assess it? Okay. See, basically temperament, like I told you in the initial stage, it is an individualistic feature of every patient or every individual, in fact. Okay. So one of the basic tenet of homeopathy is individualization. Okay. So homeopathy treats the patient, as we all know, and not the disease per se. So there is no universal thumb rule that applies to all patients. I cannot say, okay, I'm going to treat the patient in this particular way. That is why many of us may get confused. Why do we have so many schools of treatment? Okay, that is entirely different topic to discuss. But in short, I would like to say, when we have a case, I cannot decide just immediately as soon as the patient walks in. Until I take the case, I cannot decide the entry point of the case or understand the patient in a holistic way and what treatment I would like to give. Okay, because the constitution will reveal itself sometimes not even in the first meeting. It can happen the second and third meeting. Okay, so that is why the individualistic quality, what is there, I can maybe assess in my first interview. Okay, and in the end, that is going to help me to decide whether my patient is a Calcarea Cup patient. In Calcarea Cup also, whether he's a Calcarea iode, Calcarea sulf, or what you call some other Calcarea form. So we are born with this code, that is temperament, which cannot be changed, and which is the basis of homeopathic prescription. Maybe sometimes the patient projects to us the personality, so we should not get carried away with the personality. Okay, the personality, when we treat, we cannot say just because the patient is crying. That's what we do when we are in our younger classes, you know, in a second or third year. Oh, the patient is crying, and we have learned in homeopathic materia medica that pulsatilla is a remedy where the patient always tends to cry, or he has a tendency to cry. So that is what you are just maybe looking at, the what you call personality. But we go into depth. The patient was crying, no doubt about it. Okay, but there was some other reason, and the core may not be a pulsatilla patient. Okay, so that is why we need to assess. We need to not just learn, but we need to assess the temperament at the end of a case taking. You remember Hahnemann's aphorisms, the higher classes in 211, 12, and 30. He has very clearly told us this holds good to such an extent, that temperament holds good to such an extent that disposition of patient often chiefly determines selection of the homeopathic remedy as being a decidedly characteristic symptom, which can least of all remain concealed from the accurately observing physician. Like I told you, when patient walks into a clinic, he comes with a personality. Okay, he may be a politician, he may be a doctor, he may be a lawyer. Okay, so he comes with a personality, and many times, I would not say every time. Okay, many times we get confused between the personality and the temperament. So that is why Hahnemann has given us such a beautiful aphorism where he has explained to us about this. In aphorism 212, he says, even the therapeutic agents, that's the remedies that we have, that nature has provided, especially to all of us in homeopathy, also has an individual trait. And it also points out towards different what you call temperaments. Okay, disposition of mind is there, but in healthy state as well as in the pathological state. And every medicine does it differently. Okay, like even if I have a group of Calcarea as a theme, I may understand. Okay, but in the end, I have to what you call go through the temperament to understand whether it's iodine feature, okay, whether it's a self feature. You got it? And that is why aphorism 212 also what you call puts the therapeutic agents on a 4, where temperament can be actually studied when you're studying your materia medica. Aphorism 213, of course, we should not be able to cure conformably to nature, that is to say homeopathically. Yeah, we cannot treat any disease homeopathically. Even in acute, sometimes observe along with the other symptoms, those relating changes the state of mind and disposition. Okay, when we say the state changes the state of mind, we're talking about temperamental state of the individual. And if we do not select for the patient's relief from among the disease force, which in condition to the similarity of its other symptoms to those of the disease is capable of producing a similar state of the disposition and mind. This is nothing but proving that we do. Our remedies are proved in such a way that the remedies have made a difference in the mindset as well as a physical set. Okay, and that is where you are emphasizing on your constitution and on your temperament. So Hahnemann's portrait of temperament, these three aphorisms convey that a homeopathic case should include the physical generals, the disposition, the causation, and the mental generals of the patient. And he highlights the importance of taking into account the temperament of the patient to arrive at a prescription. Okay, so this is in short, I just wanted to tell you why do we study temperament. Okay, now we come to the most important and interesting aspect, study of the temperaments. Okay, so the study of temperaments makes us understand what are we made of. We in the sense, we as well as our patients, okay, who we really are, why we react as we do, what are our strengths and weaknesses. Okay, so a temperament decides that. So each individual, like today, I may face with one particular situation, but I have 3 or 4 other colleagues, or I have 3 of my other friends. We all may not react to the what you call circumstances in the same way, whether it's mental or even physical. Very easy to understand physical, because when I talk about physical temperament, when we know that in physical temp, for example, all 4 of us get wet in rain, 2 of us may catch cold, and the cold also will present a little differently. Okay, and mentally also, suppose the rain was there, one may enjoy, may feel very romantic, so beautiful, the rain is pouring and I'm enjoying it. One person is so dirty, I would not like to venture out in the rain. Okay, third person may say, now I have to go home and have a nice cup of hot tea. I'm already feeling cold. I'm going to catch cold. He's nervous that he's going to catch cold. You understand? So each individual is what you call reacts differently. That is what we are temperamentally made of. Okay. So if you, the pioneer or the most important, very clearly mentioned, of course, all the authors have talked about temperaments in some or the other ways, okay? But Dr. Herbert Roberts in The Principle and Art of Cure by Homeopathy, our textbook that we study, okay? In that, he has what you call classified 4 classical temperaments, which we study throughout our what you call BHMS as well as MD, okay? So he can call me as a pioneer for our textbook. So he talks about nervous, bilious, sanguineous, and phlegmatic temperaments. Okay, there are many combinations of these types that we have to understand. A person can be about, for example, 60% nervous and 40% bilious, or he can be 60% sanguineous, 30% phlegmatic. So we just like how we don't have clear miasms. One individual will not have one pure miasm in himself. He will be a combination of miasms, sometimes twice, sometimes twice. Okay, for example, sauropsychotic, sauropsychosyphilitic, isn't it? So similarly, even in temperaments, we may have a combination of these types, okay? But the basic ones are the nervous, the bilious, the sanguineous, and the phlegmatic. This is according to Herbert Roberts, but the new what we call homeopaths, the classical homeopaths themselves, like for example, from India, we had Dr. Parina Samranwala, who's also talked about choleric temperament and other things, which is very interesting and which fits into our homeopathic prescription. In the further what we call slides, I will be explaining to you about choleric and other temperaments also. But for time being, the basic temperaments that we learn in our second year is nervous, bilious, sanguineous, and phlegmatic. Okay. So temperament types, now I would like to add sanguine, choleric, melancholic, phlegmatic, and the nervous temperament. Yeah, please go, I will keep the screen for a second. Sanguine, because you're going, after this, you're going to enjoy all the slides because it's very lively and you will start what you call having fun in your classes when you even see your classmates. Oh, he's a sanguine temperament, he's a choleric. And that helps us to understand the patient also, okay? So remember all these 5: sanguine, choleric, melancholic, phlegmatic, and the nervous temperament. So let's go first to sanguine temperament. See the picture, okay? How beautifully, I think it's on the Facebook, you may not see it clearly, but I would just like to describe it then, okay? The key words, the understanding, how do you understand sanguine temperament? You already have learned in belladonna, sanguine area, that the patients are very sanguine. What does it mean? Sanguine temperament basically means the patient is an extrovert, he's a talker, he's an optimistic person, okay? You see how people are carrying him on their shoulders and he's also having a blast. He's the what you call Jan, you say. He's the life of any party, of any function, even as an individual in a family. Okay, he is the life of that, but he is a person who decides picnics, who decides parties, who decides there should be some fun in life. Okay, and he's basically an extrovert person. He can talk very nicely and they're very optimistic people. Okay, they always think positively. So that is in short about the keywords of the sanguine temperament. Okay, the sanguine, like I told you, is a people's person. They are very vivacious. They always manage to have fun. They will not be tied down to relationships or to any one activity, and hence are social butterflies. You know, you get patients. Like I had a patient the other day. I told him, okay, because I was going to live space, I did ask him, how do you feel? I mean, about meeting people and relationship, and how do you prefer to be in company, because basically he was an artist, or you like to be alone? He says, doctor, I don't like to be alone, I always prefer to be in company, but the thing is that I can be friend to many, but many people cannot be my friends. Okay, even the saddest person in the room, I can go and talk and ask him to open up. Okay, so I'm a good friend to everybody, but maybe not everybody is my good friend. I hope you're getting the point. Okay, so sanguine person is people's person. He may not share his everything to people, but every other person will come and share his things to him. Okay, you may find such teachers in your colleges, you may find such friends in your hostel, okay, who are like that. They live for today. Okay, you never find them worrying what will happen tomorrow, how will I, what do you call, or what has happened in the past. Oh, I didn't get good marks last in BHS 1, so how is it going to be second year? They say, okay, BHS 1 is over, now I will do well. They live in the present. Okay, they're exuberant, and even the anger is very effervescent. You know what happens? They get angry so easily, and immediately the anger cools down also. Okay, and they don't carry a grudge. Okay, there's something like a psoric individuals. Psorics are the sanguine temperament. Most of the psoric remedies, most of the psoric patients are having a sanguine temperament because they don't carry grudge, but they get angry very easily. They will shout for 2 minutes and then forget about it. Okay, so this could be a sanguine temperament. But see, every remedy, every constitution, okay, every miasm, okay, especially when it comes to miasm, we make psychotic and syphilitic as the criminal miasms, okay, and we feel only psoric miasm a good miasm. It's nothing like that. Every miasm, every temperament, every constitution has its own, what you call, merits and also its own weaknesses. Now, what are the weaknesses of sanguine? They are vanity and self-complacency. They only sometimes think about themselves, okay. They like to see the exterior. They like to expose only the exterior part, okay. So that is called as vanity, okay, and self-complacency. They want to please themselves first, okay, because they believe that if I please myself, everybody else around me is going to be happy. Okay, sometimes if you see a lycopodium, if you see a belladonna, you see this type of personality in them. Okay, they have inclination to flirtation, okay, jealousy and envy. So these are the weaknesses. It's not that just because he's a life of the party, he won't have all these things. They could easily be having these particular weak qualities also. Okay, cheerfulness and inordinate love of pleasure. Means, yeah, we should be cheerful. We should what you call derive pleasure also, you know. But all the time you always want to be cheerful and you want people around you to be cheerful. It's not possible, and so it becomes inordinate. It doesn't become very practical that every person who is a friend of a sanguine can be happy all the time. Even they need to express, isn't it? So that becomes a little bit difficult to handle a sanguine person at times. So the basically strengths, now we talked about the weaknesses. The strengths are he's an extrovert. They make easily friends with people, very communicative, loquacious. You have your lacasses, you have what you call remedies like belladonna, who talk even in when they're pathologically, if a patient has a high fever, a child has high fever, he gets so like loquacious when he is in a belladonna state or he's in a belladonna remedy. Okay, but they associate easily with strangers. Okay, they can just go and talk with strangers. They are very friendly in speech and behavior and can pleasantly entertain their fellow men by interesting narratives and witticism. Okay, so when they are in a group, like I told you, they're the life of the party. They can start any topic and keep on entertaining all the people around them. Okay, so that is the strength of a sanguine individual. So now when I want to see a patient, how do I understand the rubrics? I hope I'm not going too fast. Please, can somebody guide me? Okay.
It is going okay, madam. No problem.
Okay. So rubrics of sanguine temperament are basically after effects of excitement and emotional. Okay. Like, for example, aconite. They've heard a very bad news or they've seen a very bad scene and the excitement starts. That's a typical sanguine temperament. You know, the blood just flows in all directions. Okay. Including the physical symptoms like they have increased heart rate, It could be belladonna, it could be aconite, it could be what you call sanguinea, if you have, where you have the sun headaches, even the mentals are that way. Then you have loquacity, okay? Like for example, again belladonna, then again you call lacasis. All these people are very sanguine in temperature, okay? They're highly loquacious, they're very vivacious, okay? All these rubrics we find in our complete Materia Medica. I've tried to take it from all the 3 Materia Medica because somewhere complete Materia Medica tries to encash from all the Materia Medicas. So I've taken few rubrics which talk about the sanguine temperament, okay? So just note down, at least mentally, excitement, emotional after effects they have, loquacity, vivacious, cheerful, they desire company, they theorize a lot, okay? They can keep on inventing stories, and that's why they're very beautiful writers, okay? The poets, the writers, especially the writers, okay? Who can write about fiction, who can write about what you call thrillers. These all are having a sanguine temperament, okay? They are very forgetful people because so many things go on in their mind, okay? It's not the weakness of the brain, okay? It is because of the continuous flow of thoughts that they get forgetful, okay? They're a bit careless also. They're not bothered about what is happening because they're living the present. I should get the pleasure right now. If I'm painting something, what is happening anywhere else, I don't care, okay? And thoughts, flow of rush is there. That's why I told you they're forgetful also. And at times they can be what you call this thing. So remedies, like for example, you remember your in a Materia Medica, ferrum is there. All the ferrum remedies, especially ferrum met, it's also a very useful remedy, ferrum phos and ferrum met in what you call anemia, okay? It may sound deficient, but actually, though they are anemic, they have a flushed face, okay? Their mind symptoms also are very quick. They think very much, though they are weak, okay? Phosphorus, I mean, once you see a phosphorus patient in your OPD, okay, you can never forget, okay? And you see all the beautiful actors and actresses, even in Bollywood, most of them are phosphorus, most of them I would say, because they're very vivacious, they're very good looking, okay? For example, just a lighter note, you take Aishwarya Rai, she has very beautiful eyes, the skin is very transparent, okay, that is a physical temperament of hers, and probably as a person we don't know, like I told you, till we take a case of an individual, we cannot decide temperament, but a phosphorus individual is again the life of a party. A phosphorus child comes into a clinic, he will be having such bad bronchitis, but then the first thing that he will open the door and say, hello doctor, how are you doing? You're looking so pretty today. You know, in spite of having so much high fever or bronchitis for that matter. So the vivacity can be just noticed as a child or as an individual enters your clinic, okay? It's a pleasure for a homeopath to have a phosphorus patient, okay? Then you have lacasis. Lacasis also equally loquacity. We already have learned that rubric so much, it's by heart in our minds that lacasis is loquacity, okay? But apart from that, lacasis patients are great leaders, okay? They desire company, they can be very strong people, they can connect with people very easy, they can become very good politicians, they can become very good lawyers also. And then one more, very what you call, coffea is a remedy. Maybe most of us still are internship, we may not use it so often, but once you start your practice, coffea is one more remedy. These people are excited for everything, good or bad, okay? They have an exam, they're excited. Okay, they have a picnic also, they cannot sleep. So we give coffea for insomnia, which is caused by both the excitements, even by tension and even by excitement or pleasure. Okay, tomorrow, I'm just giving example of pediatric case because I've got many pediatric cases and I'm being prejudiced, but temperament, I feel, is one thing which you can apply in your pediatric practice very beautifully. Okay, because at least adults give you the whole history, but for a temperament, I would like to suggest to you people also, in a child, the temperament is what you call so obvious. They still have not gone into the personality phase, you know, they have not changed themselves, they are raw. Okay, the raw material can be seen easily in the pediatric cases. So most of the times I give you examples of the pediatric cases. If you have coffee a child, the mother will say, doctor, isko to kuch bhi ho, exam ho to bhi tension usko neend nahi aati hai, उसको इंसोम्निया हो जाता है, कल पिकनिक भी जाना है तो 3 बजे उठ के बैठेगा, मम्मा उठो, मेरा टिफिन बनाओ, मुझे स्नैक्स बनाओ. Okay, so that is a coffea temperament. Okay, that is a sanguine temperament. So predominantly these remedies have, they may have, I told you, every remedy will have a mixture of the temperaments, a combination of temperaments. Predominantly these remedies, okay, there are many other remedies. For example, I've given you remedies like ferrum group of remedies, all ferrum met, ferrum phos, okay, ferrum mule. All these remedies have sanguine temperament. Phosphorus has it. Calcarea phos, Calcarea as a remedy, if you see Calcarea calm, it's a very slow, sluggish remedy. But when the phos element is added to it, okay, when you see Calcarea phos as a remedy, the child, Calcarea phos children are very cute, okay? Even if a small infant, he'll have shining eyes and he'll keep on looking at you. He will keep on looking at the bright objects in the clinic, okay? So that is a Calcarea phos, what you call child. So this is how you understand lachasis, and coffee, of course, very easy to understand. Now, next, this Herbert Robert has not described so clearly, but this is one very important temperament. And why important temperament? Because as a homeopath, we don't see diseases, isn't it? We see individuals, okay? And we see individuals of all varieties. Tomorrow, when you start a practice, today, you may not have the confidence till you're in the third year because you're not having your own private practice. You're seeing the what you call patients of your hospital or of your teachers or from seniors, isn't it? But it's surprising that you get in your homeopathic practice, once you set up a proper homeopathic practice, all the type of people walk into clinic, right from politicians, right from actors and actresses, okay? You have your what you call pediatric cases, everybody. Okay, because even I used to wonder, Belgaum is a small place, but I do have some TV actresses coming to me, and we have got politicians coming to us. Okay, MLAs, MPs. So each one has a personality, and then we have to differentiate in the temperament or an individual. So in a choleric individual, choleric temperament, these people are very extroverts. They're doers. They're optimistic. They're leaders. Actually, they're the boss of a place. Okay. In a very lighter note, I would say all are leaders, all are principals, okay? All of us are into the choleric temperament category because we're extroverts, we do things, we get it done, okay? Even if I don't do it, I will delegate the work and see that the work is done. And they're very optimistic individuals, which is very important to be a leader, okay? So patients with a choleric temperament, they have an image of being authoritative, they're dominating, resourceful, they're very resourceful people, they can get the work done, and confident beings, okay? They can, from the smallest, what you call difficulties also, they will try to create opportunities, okay? That is how you describe a choleric temperament, okay? They are very adventurous, okay? They're persuasive, they're confident people, they're also powerful because they take decisions, right? They lead people, they're good decision makers, they're born leaders, and innately aggressive. When I say aggressive, I'm not saying physically aggressive, innately aggressive, because if they decide in the mind, I have to do this thing tomorrow, okay? The rubric industries also comes here, I will complete the task, okay? So these are called as the choleric people. Now, what are the weaknesses of choleric person? Like, we are going to talk about the weaknesses as well as strengths. So the weakness of choleric patient is basically they have a lot of superiority complex, naturally, because they're in leadership position. That too, not a leader, they're leader of leaders, you can say, just not leaders. They have vehement anger, okay? They can be deceitful, disguised, and they can be hypocritical also, okay? So these are the weakness of choleric. See, every remedy, every temperament, every constitution, please do not get prejudiced of it being only the good or the bad, okay? We have to understand it in entirety. Every remedy has weaknesses and the strengths, okay? So now coming to polarity, though they're very good leaders, they have superior, but they have these weaknesses also. They can be superior, they may have a superior complex, they may get angry very easily, which does not dissolve easily, okay, till the work is done. They can be a bit what you call deceitful. Deceitful is they can disgrace people or they can cheat people, okay? They can be in a disguise. They always have to wear a facade. You see, most of our politicians, they have to wear a facade, when they go in the public, they have to wear a facade according to the region that they're talking, okay? There could be hypocrisy also, okay? Then lack of sympathy, okay? You have very good examples in history. For example, Hitler, okay? He had all these qualities and lack of sympathy. They can do anything if they desire, okay? So sympathy part is not very prominent in a choleric temperament, okay? So that is one thing you need to remember. Like, for example, again, I'll tell you a pediatric case. The other day I had a case in my clinic and the mother says, "Doctor, I'm so worried about my child. We get so scared of frogs. But now it's raining very heavily in Belgaum, so all the frogs come in a compound and stay there, okay?" So he says, this guy, this small little one, this child who has come for some adenoids to me, the mother was saying, he just goes, takes the frog and crushes it. Imagine, okay? There's no what you call fear and there's no sympathy to that animal, okay? So that is how a choleric temperament can manifest to you. Now, coming to the strengths of the choleric. So what is, they're very successful in the professional work. They're this is a very active temperament, okay? They have to finish the work what they have started. A continual inclination to activity and occupation, okay? They don't get tired. They love their work, you know? You must have heard some patients telling you or some people telling you, okay, that I enjoy my occupation because that is my passion, okay? Many, few of us are fortunate enough, okay, to have your own passion or hobby as an occupation, okay? So that is how it is. Suppose you are going to be a homeopath, right, in coming years. And so as a homeopath, what should be your passion? Of listening to people, understanding, getting into the analysis. If that is your passion of being with people, then you can be a very good homeopath, okay? So there's a continual inclination to do something about the activity and the occupation, okay? They don't want to be an average homeopath. They would like to explore more. So tomorrow, most of us, I'm sure we are going to be in some ways choleric. We will like to attend seminars, webinars which are going on. See, your university is doing such a great work. I mean, series of webinars is really a very, very, what you call, a very good initiative taken by all your principals, and it is really going to be helpful to all of us, okay, the entire homeopathic fraternity, because when we watch all these webinars, we learn so much, okay? So there's a continual inclination to activity and occupation, and I want to learn, I want to attend all the webinars as far as possible, okay? He cannot be without work. They're not people, okay? Sanguine to some extent, they can, okay, be happy, joking and all, but forget their work for some time, but not a choleric person. Huh? He cannot be without work. And he works quickly and diligently in the sense, very systematic way, okay? He's in his enterprises, like in his work or in his what you call vocation, he's persevering and full of courage in spite of obstacles. See, every profession will have some of the other obstacles, okay? Every individual also will have some of the other obstacles in their life, but this person has that what you call extra innate quality of being persevering. Okay, I've got this problem, what is the solution? I will not look back. I will try to find a solution. I'll talk to people and get it out and try to make the work easier and remove all the obstacles and thus be successful. Okay. And without hesitation, he can be placed a difficult post. It's not that, suppose I'm at a position where I have to, what you call, delegate some work. Okay. It's not easy for this person to say, okay, now you've been working like a sweeper, but even if he's a sweeper, I'm telling you that he could be a choleric, but tomorrow you can just post him as a clerk. Okay, because he has the ability to shift from one gear to another gear. Okay, and everything can be entrusted to him because we know that he will learn the tricks fast and he will what you call utilize in the what you call in his work. Okay, in his speech, the choleric is very brief and definite. They don't talk to what you call elaborately, like how in sanguine you have very loquacity is very marked. They keep on describing things. They make it like a story when they talk to people. In a choleric person, a typical leader, you know, very brief, to the point. Okay, he thinks that talking to people unnecessarily is waste of time. So he abhors useless repetitions. Okay, he doesn't like to repeat often. And this brevity, okay, this positiveness, firmness in his speech and appearance gives him a great deal of authority. Okay, when you see this person is talking to the point, talks very firmly, then you automatically feel some distance with him. You feel, okay, he's a leader, I should not go beyond that. Okay, it gives him a great deal of authority, especially when engaged in educational work. Okay, so whenever they're in any educational institutions, maybe as a professor, as a teacher, okay, this particular type of firmness, okay, speech and the use of correct and adequate words, I would say both adequate as well as correct words, gives him a better edge than the other people in the what you call institute. So again, rubrics, you can just note it down mentally, or if you're taking with a pen and paper also. Usually the rubrics of choleric temperament, when we see in all the repertories, it is after effects of anger, vexation. You can simply close your eyes and know that this is a choleric temperament. Okay, and the patient is industrious, censorious. What is the meaning of censorious? Going into the depth. Okay, going to the transparency point. Contradiction intolerant of, they cannot tolerate contradiction. Just like how we have a natrimure, we have a natsomika. Okay, they just hate to have contradiction. Okay, because I would not say every time, but most of the time they are correct. And so somebody tries to interfere and tries to give the theory. For example, a sanguine person is trying to impress a choleric person, and then he's gone for a toss. Okay, they just cannot tolerate it. So they are haughty, they're malicious, destructive. So these are the rubrics that you can find in our repertory. Impatient, capriciousness is a very what you call common word, which we try to understand where to use it in our case taking. Okay, so capriciousness is there. Dictatorial, quarrelsome, thoughts, ideas, abundant change, and clearness of mind is there. So it's so beautiful. Homeopathic Materia Medica correlates with our organon, and organon in turn correlates with the patient holistically, isn't it? So if you try to, that's why I wanted to say, we need to assess the temperaments, which is a very small part of the constitution, but then we can come to the whole. We are only seeing a part. Temperament is only a part of the whole, okay? But this part is going to manifest the whole now. Okay, so we have remedies like lycopodium, we have remedies like veratramal, nux vomica, bryonia. Okay, just recently I had a case of renal calculi. This patient was basically came to my waiting room. I have a big waiting room, comparatively a big waiting room, and so he was a bit. He's some what you call a big businessman of my town, and so he was waiting at the reception. And so what was my receptionist told me this, his action, because even she is trained to understand people now. She says he was very what you call this thing, because he didn't want to waste his time waiting in the waiting room. His turn had not yet come. Then he asked another patient who was sitting next to him, from how many years you come here? Then the patient told him, I've come here from 2 years. Oh God, from 2 years of coming and it's still not better. Then the patient says, the other patient said, no, my condition is that way and I'm getting better. Okay. And is she a good doctor? Okay. Now he will try to gain all the information in that short period before meeting you, because the first time meeting is good. Then the patient said, yeah, she seems to be good. Yeah, even I've heard about it, but she's charging so much. Do you think it's worth that much? You know, they're very censorious. They're very what we call capricious. They want everything in a proper this thing. Whether meeting this doctor, okay, that is a choleric temperament, is worth it. Okay. Of course, I didn't give him only because I was not seeing this situation outside. But when I talked to my receptionist, for some reason we spoke, and she was telling me this patient is very irritating, ma'am. He was so this thing, and then he came and asked me also, कितना time लगेगा डॉक्टर के पास? ऐसे सबके साथ इतना time लगता है क्या? मुझे भी इतना time मिलेगा क्या? You know, so this was a type of thoughts, and he was very clear why he wanted to come to me. Okay. Because he felt once you take homeopathy, and once somehow that name was there, somehow some good person referred to him, a good friend of his referred to him. So he was very sure that he'll get better here. And when he opened my door, when the patient went away and his turn came, you won't believe, he was such a pleasant person. He just said, hello, good afternoon, doctor. I didn't know you were such a pretty and young doctor, and also all the flowery things. Okay. And then he started telling his history. See, he's already in the waiting room, tried to extract how the doctor is, what it is. Okay, he's very clear with this thing. And when he comes inside, he's a very what you call person who has a different persona in front of you. Okay, so they can be very what you call industrious. They can be very censorious. You know, they can behave. They know to wear a facade very clearly. Okay, they're leaders. They want the work done from this doctor. Okay, fortunately, lycopodium was his remedy. Right-sided remedy it was. Okay, he had recurrent kidney stones, but this part of a temperament also somewhere helps you. Okay, because I did feel at a time this patient was looking like a little bit like natriumur also, because when I went to the history, contradiction intolerant also was there. Okay, but when I gave lycopodium, the result was very obvious within few days, and now it's almost few days actually, just few days. He's feeling much better, and he's going to come back for the treatment, which indicates the patient in general also is feeling better. I will follow up the case later. Okay, so I just wanted to make you people understand that how temperament has to be taken in your entirety when you're taking the totality. Next, we come to the Devdas temperament, okay, the melancholic temperament, okay. Amongst us, we have all type of friends, isn't it? We have sanguine friends, we have choleric friends. Now we'll have a melancholic temperament friend also, whom you can identify right now. Maybe not in a patient, at least start understanding people. I'm not saying judge people. We need to assess people, okay? Don't judge people. Don't judge your patients. So what are the keywords for an introvert melancholic temperament? They're basically introverts, they're thinkers. Okay, they think a lot. If they have a project in hand, they will think the pros, the cons, everything, and then they will decide upon working for the project. And they can be pretty pessimistic. Unlike your choleric and unlike your sanguine, they are very optimistic people. These people can be very pessimistic. So they think a lot. If it goes wrong like this, what do I do? Okay, so that will be their fourth thinker. Okay, so the deep thinkers, they can be very good writers also, just like how I told you, even in sanguine and choleric you may have, but melancholic temperament people usually write the sad novels, the sad songs, the lyrics. Okay, so they are that type of people. They like to be to themselves. They're the backstage people. In your group also you may find, no, when there's a function in your college, there are some people who are on the stage all the time. And there's some people who just are at the background. They're doing all the work, but they don't want to come on stage. Okay, they will look at the stage arrangements, they will look at the finances, everything, but they don't like to be exposed. Okay, so that could be a melancholic temperament. So melancholic temperaments are basically thinkers. They are people with serious purpose, okay, dedicated to order and organization. They appreciate beauty and intelligence, okay. They're thinkers. They look at you in that particular way. So you have patients like this in your clinic who says, doctor, I like, when they walk into your clinic, not every patient who is sick, especially when a person is sick, will not say, oh, your decorations are so good here. You have such a good piece here and you kept your clinic so clean. So when the patient starts talking to, my mind starts opening up there, let me understand what his temperament is, because even we have to be quick. Just because we're giving constitutional treatment, I cannot take months to decide upon constitution in today's era, isn't it? We need to give results. We need to come upon the remedy quickly. So these people are appreciative, okay? They appreciate you, they appreciate the surroundings, okay? And they appreciate intelligence also. If you are a good person in their organization, in their institute, okay, they will appreciate you. Okay, this person is intelligent. He deserves to be promoted. He deserves to be demoted. They are very clear with that thinking. They are very creative. Okay, conscientious. Okay, conscientious sense. Whatever is right is right. Okay, they cannot what you call fake like a choleric person. A choleric person can be a little haughty. They can be a little mischievous in that way, but not a melancholic person. Okay, they're very fastidious and they're very thorough in their work. If it has to be done like this, it has to be done like this. The teacher may say to the student, no, your work has been very good, but he'll not be satisfied unless he feels that he has gone in a particular way and completed it. Okay, so all men of genius, writers, artists, musicians, okay, Leonardo da Vinci, all these people, they had a very very sad personal life. Okay, because they are basically melancholic temperaments. Okay, but they're beautiful artists. They created art out of their melancholy, out of the sadness. You have some musicians who give you the best of music. Okay, the sad music, it touches your heart. Okay, so they're usually genius people because they also think a lot and they have purpose. When they think, they're just not thinking only pessimistically. They're having a purpose. If I do this, how it should come out. Okay, if I paint this picture, how it should look. Okay, so if you just superficially, whatever we know about the history of Leonardo da Vinci, I was just reading some time ago. His whole life was so much of melancholic things, so much sadness was there. But if you see his pictures, you see today the Mona Lisa, you feel when you look at her, she smiles. When you are smiling, you feel she's smiling. When you are sad, you feel. See, that is a type of artistry that he has put up in his painting. Okay, so these are the melancholic temperament people, very, very good in their work. What is the weakness of melancholic? Inexpressiveness. They cannot express properly. They may be very good in their job, but they cannot come and express. A sanguine person, he may do a small job, but a student will go and tell the teacher, I've done this, I've done that. Everybody's impressed because he knows how to present himself. Okay, so this is a little difficult with the melancholic person. We have to recognize them by their art. Okay, they're a little bit reserved. They don't like to talk about themselves. He finds it difficult to form new acquaintances. Okay, you may have a natrum individual. Then you may have urgent and nitricum individual who will not be very free to go and make new people acquaintances. Calcarea carb is there, okay, and they speak very little among strangers. So very few close friends they'll have, okay, but they'll open up to them. Even to them, they will think, why should I burden my feelings to this person? Is this my weakness? Or they also feel, why trouble others? Okay, so you may have a patient who says, doctor, I don't tell everything to everybody. Okay, like for example, natrum person may say, I don't like to talk about myself because I don't like to express my weakness. Why should people understand my weakness? Okay, whereas a Calcarea patient also may be a melancholic person. Okay, he says, I don't like to express because I can't express. I feel very shy. There could be another person, for example, a lycopodium patient who is having a melancholic temperament. So he will say, no, I feel, why burden others with my problems? Okay, why burden others with my problems? So I keep it to myself. So most of the time, because they are not expressive, their talent becomes underutilized. It becomes, they don't express the talent so quickly like others because they're reserved. The pride of the melancholy also has peculiar side. He does not seek honor recognition. Okay, they don't like to seek honor, even if they've done a very good job. Okay, they would not like to be honored. On the contrary, they'll hate to appear in public and to be praised. Okay, they will do the background work, backstage work. Okay, so that is some weaknesses of the melancholy. And they're very unforgiving nature and lack of assertiveness. Why unforgivingness? They will not be aggressive. But if you hurt them, because they think a lot, they feel things they're melancholic people. Try to understand. A typical Devadas type of people, They can hardly forgive offenses. They may not go and fight back, but they'll keep it in their heart, just like an actor. They keep on accumulating throughout their life hurts and distresses. The first offense he ignores a little easily, but once again and again, the same offense is committed by different people also, not by the same individual. It penetrates deep in the soul and they become hard. They start protecting themselves and they'll forgive maybe because they're good people, but they cannot forget. Okay. Strong aversion easily takes root in their heart against person for whom he has suffered or in whom he finds this or that fault. Stephisagre and natriumur are very good examples of our remedies. Okay. Pathological fastidiousness. Now again, if you remember your arsenic, okay, there is fastidiousness to some extent is very good in all of us. But if it is pathological, imagine an arsenic patient when he goes to his house, the portrait in the house is slightly tilted. He will not like it. Okay, he gets irritated. He'll tell his wife, he'll tell his kids, please make it straight. If they don't make it, he'll climb the stool, make it straight. Okay, till that he will not be this thing. Okay, most of the OCDs, obsessive compulsive disorders, we can find in a melancholic individual. Okay, or the melancholic individuals have this quality. The cause of his exasperation, that is his distress, is often justifiable. It is justifiable, no doubt, but some other temperament would forget about it, but he will not forget. Okay, and but rarely to the degree felt. Okay, so the justification is there, but sometimes we better to ignore it and go ahead in life. No, otherwise we can't think. But not for a melancholic person. He says, no, this has to be done, it has to be done, whether it's by me or by you. Okay, including for themselves also, they have very high standards. Okay, so that is the weakness of a melancholic patient. The strengths of melancholic temperament: he is willing to make great sacrifices for his neighbor and is strong and unshakable in the battle for ideals. Okay, a person like a causticum remedy, okay, they would like to fight for people. If something is right, it is right according to them. That's why I say that's why they get hurt easily. You know, they don't have that little what you call thing where they say, okay, forget and forgive. Forget also. They don't forget. So that is how it is. But they can be very good friends. They will sacrifice anything for you as long as everything is going as long as you're a good person. If you're a good person, even if it is against his wish, he will go and fight for you. Okay. They're good at decisions and have a strong sense of responsibility. Okay, they are good at decisions. Why? Because they think a lot before taking any decision. They think and think. It's not like a sanguine where they take a hasty decision. Choleric also take hasty decisions, but they still have some responsibility. But in melancholic, it is totally responsibility. Okay, they feel if I do this, it will hurt my society, my people, my family in such a way. So I have to take the right decisions. Okay, though they cannot be great leaders, this quality is a leadership quality actually, because they don't express, but this quality is there in them. They adhere to the rules and they need very little control over the life and behavior of others. Okay, so nobody can point out if a helmet has to be worn, they will wear it. They will not question you why. Okay, they will not say it is so hot, why should I wear a helmet? Other person is not wearing. They'll not argue with the police. They know they're not worn a helmet. They have gone against the rules, so I will pay the fine and go. Okay, so these are the strengths of a choleric temperament. And melancholic temperament. Okay, now what are the strengths of the melancholic temperament? The melancholic often is a great benefactor to his fellow man. I mean, people rely upon a melancholic individual because we know he's a little bit what you call sad person, but we know he will be there with us. Okay, all the real what you call gurus, if you say in that sense, he guides others to God. They are very what we call spiritual people. They're good counselors in difficulties, and they're very wise. They're not just talking people. They think in all aspects and talk to individuals. So they can be very good counselors. Okay, they're very trustworthy. You know, whatever it's just a joke. We'll come to know how a homeopath should be later on. I will tell you in the end. But then if a doctor is of a melancholic temperament, especially in a homeopath, he can be a very good counselor. He can be a very good treatment, and he will not leave the patient till the end. You know, because that much sense of responsibility towards his patient. All doctors have it. All whatever their constitution and temperament is. But if it's a melancholic, this is how it is. Okay. So he has great sympathy with his fellow men. Like you must have heard that doctor hardly speaks anything, but he's such a big crowd. You know why? Because when he's talking one-to-one with that patient, he's an excellent doctor and a human being, right? He has great sympathy with his fellow men and a keen desire to help them. Okay, it's not superficially like a sanguine temperament just to be on the leadership helm or to enjoy for time being. Okay, sanguine temperament will say hi, hello, and make you feel you're the best person in the world. But next time when he meets another person, he may not even look at you. Okay, not that he has any grudge or he dislikes you, but that is his nature. But melancholic, no. Once he likes you, he'll always like you. Same thing, it happens. No, even if he's angry with you, if you have repeatedly hurt him, he will not forgive you. Sorry. So rubrics again from all the Matrimedica that we can gather is, sorry, from our repertories is after effects grief, conscientious about trifles, small things all they're worried, sentimental in nature, fastidious, brooding, industrious, okay, company aversion to, mildness, sympathetic, hypochondriasis, suicidal tendencies, Oram Met, okay. When you read Oram Met in Kent, what does he say? This person had everything in life. He had a good position, he had good family, but for some one silly reason, one fine day, he goes and hangs himself, okay. So these are type of pathological suicidal tendencies a melancholic temperament can have. Okay, so Oramet is a very good remedy. If you read Kent, I think we all should read Oramet from Kent to understand Oramet personality and temperament and the constitution. Okay, and so they're very thoughtful people. Thoughtful. This is a rubric that we have in our repertory. In Kent's also we have it. Okay, so this is I've taken it from what you call the common repertory, right? But you can go to different repertories and gather it again. More also you can add to it. So remedies like Natrimute, Ignatia, Oramet, all these indicate your melancholic temperament. Now we come to one more very interesting, and I think everybody can understand in the first look itself. Okay, when phlegmatic temperament comes, you see the picture how she's okay. They are basically having fat, fair, flabby. That comes in your mind, Kalki, isn't it? So Kalki is a very good example. I'm telling you the beginning only of a phlegmatic temperament. So they're basically introverts. They watch. Okay, so if you see a phlegmatic temperament child or individual, they will just come and just stare at you like that. They will not say hi, hello, nothing. Okay, they will slouch like this. They're not even sitting erect like that. You know, they're just slouch like that, and they're just looking at you. We don't know whether they're admiring you, what they're thinking about you. Okay, they watch whatever you're doing. Okay, you will pick up your maybe stethoscope. You'll pick up the your bottle. Whatever, they observe things. Okay, they're quite pessimistic. They're introvert and pessimistic in nature. Okay, I cannot do this. That's because of, I'll tell you in further slides. That's basically because of their physical and the mental constitution altogether, and that is how the temperament is built. Persons with phlegmatic temperaments are extremely slow-paced and stubborn. Okay, but that's what's a classic example is Kalki. Very slow-paced. Anything you tell them, they will say, "I will do it now." The child will tell them, "But I'll do it, Mama. I will do it." And if it gets in their mind, I don't want to, they'll not do it. Baraita ka, okay. Though we give Baraita ka mental retarded, so many mental retarded kids are so stubborn in nature. You know, the carb element is there, the phlegmatic element is there in them. Okay, this temperament goes through life doing as little as possible, quietly and expending little energy. Okay, you have graphitis also. I have a graphitis patient who's improving so beautifully for his psoriasis. Okay, this person is very well to do, from a typical Marwadi family, having a great business of metal. Okay, he has metal industry in Belgaum. When I started this case, I thought he is a Kalki because he was fat, fair, flabby. Somehow you get prejudice in the first meeting. But when I went on taking the case, his aversion for sweets, everything, the whole physical temperament also started manifesting. And this person says, last 15 years, I pay through the nose to my manager. He looks after everything. Doctor, I even to lift a phone and talk to patients. Either I'm anxious, I feel I can't do that much work also. Every time it's something like urgent writing him speak, but it's not urgent writing, it's a graphitis person. He says, I feel very bad to get up and go to my office also. First I'll call up my manager. If he's there, my day is very good. Suppose he takes a holiday, I'm gone worst. Okay. So they do as little as possible. Huh? And they expend very little. They'll sit in that place and they will order things. Royal people. Only sleep can regenerate a phlegmatic. That's a very important point we all should know. Okay. Once they sleep, and they get up, the headaches disappear, the acidity goes away. So many physical complaints. You'll have many such remedies which we'll discuss. And you also can go through your Matrimedica and remember the phlegmatic temperament when you're reading the Matrimedica. They're the ones who are not ruffled by anything. In the sense, they're not strong. But if something bad is happening, oh, how sad, they will just say and keep quiet. Okay. If it's a melancholic temperament, he will find why it is sad, why the floods have occurred, what will the people eat? I will go and help them. I have one sweater extra, I'll go and give it to my people, or even if I can remove my sweater and give it to them. So that is your melancholic person. But phlegmatic, not bothered. I am happy, everything's fine with me, it's okay. Okay, they are in their own world, they're happy for themselves. They don't cause trouble also, that is there. They will not interfere unnecessarily in people's work. They easily get along with others and they don't have any enemies because they feel if I make a little enemy, if I displease a person in front of me, the work will not be done. It will come on me. Who will do the work? They're so lazy, you know. So that is a phlegmatic temperament. So what are the weaknesses of phlegmatic temperament? He is very much inclined to ease. Okay, they like easy life. They keep on eating everything, binging. Okay, you may have patients who binge a lot, who put on weight, and they will come for obesity issues to you or thyroid issues to you. And you know, most of these people are phlegmatic temperament. Huh? So eating and drinking is their pleasure. Okay, they're lazy and they neglect the duty also. Okay, sometimes, not sometimes, most of the times, the phlegmatic individuals cannot be entrusted with responsible duties, like how you can do to a melancholic. Okay, how you can do to even what you call a sanguine sometimes. Choleric, of course, they order duties. Okay, the phlegmatic person has no what we call ambition. He does not aspire to be lofty, go ahead with his job. मेरा इतना industry है, इतना ही काफी है. I have only one girl child. My patient says she'll get married, and after marriage, everything what I have is hers. Why I have to work hard for it? Okay, so he has unwillingness to become involved, tends to be observer rather than a participant. He has indecisiveness, the tendency to procrastinate. Tomorrow I will get up and do the work. Tomorrow I will start yoga. From so many days I'm telling you, please start your yoga at least if you're not able to walk because of your knee pain. Okay. He'll say, I'll do it next time. Every next time till so many follow-ups he's finished, but he has not started. Okay. He might give up halfway through a project if he feels there's too much effort involved. He'll start the project maybe on your pressure, but if he feels itna kaun pressure lega dimagi taur pe or physically taur pe, I will not do the project. He can just give it halfway. Okay. Phlegmatic works very slowly. Okay, they work perseveringly. If his work does not require much thinking, they are very happy. Something which is very mechanical, like a robot, they are. Okay, get up in the morning, clean the what you call katta, do this. If a maid is in your house, if she is a phlegmatic temperament, she will do the work. Okay, but very slowly in her own pace and regular work. Something new, they cannot do it. Okay, they're very good workers at the clerical level. Okay, even this is very good because most of the time clerical work in copying down. Of course, now computers have come to a little bit, you have to use your brain. But once they are thorough with that, they can do the job very. Okay. They do not get easily exasperated or sad either by offenses. Somebody tells them something also, they're very happy-go-lucky person. Khate pite. Oh, he told some joke, they'll take it as a joke and forget it. They're not affected by failures or sufferings. Okay. Even if I fail, it's okay. They don't bother. And he remains composed, thoughtful, deliberate, and they have cold, sober, and practical judgment. Okay. नहीं उसका ऐसा होना था, उसके नसीब में ऐसा था, इसलिए हो गया. Okay, they can be that what you call cold, and they have very practical judgment. Again, they should not be involved in the work. They will give a judgment. Okay, they have no intentions and they do not demand much of life. Okay, they feel जैसा है उसी में हम खुश हैं. Okay, they will not want to do extra for their family or for themselves also. Okay. Like very nicely, nothing ruffles their feathers. Okay, if it's a bird, like we say, no, ruffling the feathers means sometimes we shake ourselves to do something. No, they will not do that. Gym nahi jana hai, yoga nahi karna hai. No, that is involves a lot of vertical work. I will not do that. मैं ऐसे ठीक हूँ, मैं दवाई लूँगा ना, आप दवाई दे दो ना डॉक्टर. आपका तो होम्योपैथी सुना है कि बहुत अच्छी दवाई है डायबिटीज के लिए, थायराइड के लिए, दवाई तो मैं दवाई ले लूँगा. Okay, but they will not. We will try to explain to them it is a lifestyle problem. You need to do some physical work. They are not bothered about it. Okay, so this is the strength of the phlegmatic temperament. So rubrics again, after effects of mental work, sluggishness, confidence, childish they are, irresolute, they cannot take decisions, indolent, aversion to work, mildness, timidity, and they're not very creative people. So remedies like Kalkiriya ka, Baraita ka, Pulsrilla, all predominantly have phlegmatic temperament. Most carbons belong to this temperament. Okay, all the carbon group of remedies that we have. Okay. So now we have last this thing. This is very important, and as students, I think we will face many such temperaments. It may be temporary. Okay, so the keywords for a nervous temperament are basically the introverts. They're anxious and even they are pessimistic, just like what you call melancholic people. Okay. So persons with this type of temperament may be undisciplined and forgetful. They take undue stress. They take stress very easily. They lack confidence. They always feel before doing any work, like lycopodiums and even your argentum nitricums. It could be anticipatory anxiety, or it is anxiety till the work gets over. They're very impatient, hurry. They want results very quickly. They have to do the work very fast. They're indecisive, hesitant, timid, and they're very messy people, okay? Because they want to do everything so quickly, okay? They want to finish the task. How it is done, it doesn't matter to them, but the task should be over, okay? Such people can never make up their minds. They go to a shopping, they'll not know which color to choose for their dresses, for the kids' dresses, maybe whatever, okay? And the decisions can be changed easily. If you influence them, they can get influenced very easily. I say, you do it like this, miss, he will listen to you. Somebody else will come and say, no, it can be done better like this, he will do that way. He doesn't have his own mind, what I mean to say, okay? You must have, if you remember the story of the donkey and the father, you know. Some of the other traits are they are very haphazard, inconsistent, and very unpredictable. Means I know if I give a nervous temperament, I'm not sure whether the person will be able to complete the work because of his nervousness. Okay. So they have tremendous anxiety. These are weaknesses which lowers down their potential. Okay. They perform by the fears instead of the capabilities. Okay. Some people know I can do this work so well. For example, choleric person. So they perform really well. These people perform because they have fear of failure. Okay. So they will perform it. Very pessimistic in their approach. They'll have anxiety first before starting the work itself. Out of their negative vibes, they turn extremely conscious towards their problem. They're excessively obsessed with health. Okay. All the people who keep on coming to you, or they go to so many cardiologists for the health checkup. Of course, a lot of patients with COVID also we have seen of nervous temperament. You know, they keep on checking the ECG. Do I have a heart problem? Has the COVID affected my heart? And seem to unnecessarily dwell on it. In spite of having the correct, what we call reports, the doctor explained to clearly, most of IBS, irritable bowel syndrome patients come in the nervous temperament. Okay, if you go through your cases, you will understand this person has of a nervous temperament. So weaknesses, they're not very good at decision making because they get swayed easily by anybody says anything to them. Okay, they can be good workers, they can work under somebody. Okay, but they cannot be leaders. Okay, cannot take any change in the life very easily. Okay, a situation like that would disturb the person. If something goes out of the way today, I have to take a roundabout turn because the road is blocked, they'll be very anxious. They're very unpredictable. They're not sure about themselves as to whether to go to the east or the west. Okay, so this is just a simple example. They're punctual with appointments. Okay, that's very important because they're so nervous. They feel if I become late, something is going to happen. So they're very punctual with appointments. That's the strength of this nervous temperament. Always well prepared before a presentation. Suppose at times you may find your classmates, some people sleep throughout the night and morning 10 minutes they'll get up, prepare all the PowerPoints, 15, 20 and come and present. It could be a sanguine personality. But nervous temperament, at least 1 week before they have to start presenting and go through it again and again, take help of so many people in understanding, and then they will present it. Okay, they're very alert while approaching any problem because they don't want to. They feel very nervous. What if I fail? The fear of failure is so strong in a nervous temperament. Okay, if they're encouraged, they make actually very good speakers. Okay, they're actually very what you call precise, but they need to be pushed. Once they're pushed, they will, for example, lycopodium patient. Okay, once he's put on stage, he will speak very nicely. But till he goes to stage, he's a very nervous individual. Okay, so they need to be encouraged. They can be very good speakers because they have very good vocabulary. Okay, and preparation is there. No, they prepare a lot, so they can be good speakers, but they need to be pushed. What are the rubrics? Again, taken from your complete repertory. Anticipation, after effects of all the anticipatory remedies like argentum nitricum, gelcimium, arsenic, all these come in after effects of anticipation. Confidence, want of, confusion of mind, starting or startle, both these come together as one particular rubric. Okay, in our materia medica, hurry, impatience, hypochondriasis, fears, timidity, and restlessness. Okay, so remedies like I already told you will help us in what you call understanding a nervous temperament. Okay, yeah, we have some more time to go, I believe. I'll continue further, no, another 10 minutes maybe, that's all. I'll just end it up. I know I've extended the timing. I will just try to make it short. So the rubrics applicable to more than one temperament also can be there. Okay. Example, restlessness is common to all the temperaments, but the reason behind the restlessness is different for each remedy. Okay. In arsenic is different. In nux vomica is different. Okay. Nux vomica comes with a very what you call irritable restlessness. Arsenic comes with a very fearful restlessness. Okay. So we realize sanguine restlessness stems from enthusiasm to do more work. Nervous restlessness stems from a lack of confidence and fear of. Rubrics applicable to more than same thing. Industrious can be a what you call a trait in all the temperaments. Okay, when it comes from melancholic, it's different. When it comes from what we call choleric, it is different. So how the work is done, how the task, I've already explained to you in detail. I will not repeat it again. We'll go to better things. Okay, so in short, sanguine is the one who talks. Okay, sanguine is the one who talks. Choleric is the one who is more action oriented. Leaders, okay, leaders who are at the forefront, who lead huge organizations, who lead the country, okay, they are choleric people. Melancholic is the one who ponders. Ponders means things. Okay, phlegmatic is the one who just watches the scene. Calcaria calm. He will just watch. He will not go and pounce upon somebody and try to get involved in that work. Okay, nervous is the one while looking at the scene gets irritated and tensed. Okay. So the advantage of using temperaments are many. You must have realized by now. We can use them as a filter to arrive at the final prescription after the repertoire list is ready. By incorporating temperaments in our case taking, we can understand our patient better, and thus you vibe at his wavelength and make him open up more easily to you. Okay, because I know how I can talk to nervous temperament. I know how to talk to choleric temperament. So my case taking and the rapport that I develop with my patient for a better constitutional remedy becomes easy. Okay, so these keywords, maybe we can give you the printout later on. Just have a glance. Same thing, I put it in a tabular form. Okay, the whole thing. So advantages, again, the management of each individual case is a tailor-made. You know, that's why we say we tailor make our what you call remedies for a patient. No? Each patient, we don't give common remedy to all the cold patients. We give separate remedies depending on temperament and the constitution. Hence, you give measure, detailed instructions to the nervous temperament. When a nervous temperament, you know you have to give very detailed instructions about the food and other things. Okay, if it's sanguine, we know how to give it to them. Okay, choleric patient will have lot of what you call questions. Why are you telling like this? Why are you telling that way? Okay, so this ensures success in our practice. This will make you a little better practitioner than your colleagues if you understand temperament in such depth. Okay, so advantages in materia medica, it's very easy to grasp materia medica when you understand temperament and study your materia medica. Okay, because it's such a huge topic. We have 3,500 odd remedies. Okay, it's very difficult to remember every remedy, including the constitutional temperament. But if you understand the temperament well, you can just group it. For example, carbon groups are melancholic, isn't it? So the understanding of each remedy given in any particular rubric also makes it very lucid or very easy. You avoid becoming myopic in your practice if you're studying temperaments, okay, or you're taking the help of temperaments. The study will help you widen your horizon in terms of understanding the potential remedies. What other remedies can come apart from this? Okay, otherwise it becomes very common, just common remedies you keep on practicing. But you understand temperament of an individual, you know this is how the temperament is. This remedy is not fitting into this temperament, so I need to explore more further in my materia medica. Yeah, now this is the basic question. As a homeopath, which temperament will make a best homeopath? Of course, we don't have an interactive session, so I only will give you the answer. Please note down. Okay. The homeopath is expected to be phlegmatic in receiving the case. Why phlegmatic? Because phlegmatic are people who are observant, who will not interfere unnecessarily, who will not talk in between. Okay, and they take it very keenly, very patiently. Just look at the patient, just observe carefully what the patient is talking. Sanguine in his approach to the patient, he should know, okay, this patient, I'm going to treat this patient well. Okay, the sanguinity should be there. The patient should feel enthused to come for his next follow-up and know that homeopathy is going to help me. That is how my approach to a patient should be. I should encourage him in that way. Okay, I should myself be very vivacious so that my patient feels happy to know that he's in good hands, he's in safe hands. Okay. Melancholic also we have to be when we analyze the case. Okay, we should not be quick. Melancholic people, how they're the thinkers, they think a lot, they think for the good of the people, they think for the good of the patients. Okay, so analyzing, when we are analyzing, we should be a melancholic temperament. Okay, and we should be choleric in the final prescription. There should be no nervousness in our prescription. Okay, in the final prescription, and at no stage a homeopath should be nervous temperament. Okay, because then it's very difficult to prescribe for a patient. You got it? So these are bibliography. I think it will be small handwriting on your Facebook, this thing. So all the base books I've taken, lots and lots of Matri Medica and Organon books, some few points here and there, but very good for understanding temperaments. So thank you very much. This is my email. If any queries, you can always mail to me. Thank you so much. I think the N should be small letter.
Thank you very much, madam. Actually, the session was very informative. Now, I would like to request Professor Dr. Hitarth Mehta sir, Principal, Rajkot Homeopathic Medical College, to give his concluding remarks. Mehta sir.
Thank you, respected Dr. Panda sir. Today we are having the resource person of today's webinar, Dr. Sala madam. And the topic itself is a very interesting one, assessment of the temperament and its application in homeopathic prescription. Madam started with the theory of the constitution, means natural condition of body, mind, disposition and inherent nature. And the constitution and temperament very close relatives to each other. Then madam expresses the diathesis, means the constitutional or inborn state which disposing to diseases. And according to Stedman dictionary, the temperament means it's a psychological and biological organization peculiar to individual. Then madam started with the constitution having two variety, that is mental and physical. Mental is divided into temperament and personality. So physical, which is divided into general and diathesis. So there is very linear demarcation between the temperament and personality. So personality means overall facet that we portray, means attire, clothes that we wear. We all born with the temperament traits. Homeopathy, which believes on the plane of the individualization. Every person is like a unique. So every man is individual from one to another. Homeopathy treats the patient, not the diseases. So temperament, which cannot be changed, and nicely correlate with the Hahnemannian aphorism, that is 211, 212 and 213. And the core of the aphorism, that is importance of temperament of the patient, to which arrive at a prescription point of view. And temperament means who we really are, we react, what are our strengths and weaknesses. Then madam emphasize on different temperaments, that is sanguine, choleric, melancholic, phlegmatic and nervous. Sanguine, that is strength, that is extrovert, talker, optimist, vivacious, very communicative. Weakness of sanguine, that is vanity and jealousy. Choleric strength, that is extrovert, doer, optimist, very successful in his profession. And weakness of the choleric temperament, that is superiority complex, anger, lack of sympathy. Then madam switch on to the melancholic, that is introvert, thinker and pessimistic. Strength of the melancholic, that is great sacrifice personality, strong sense of responsibility. Weakness of the melancholic temperament, that is expressiveness and reserve. And phlegmatic temperament, that is introvert, watcher, pessimistic. The strength of phlegmatic, that is practical judgment, sober in behavior. The weakness of the phlegmatic temperament, that is neglects his duty and tends to observe rather than participate. The nervous temperament, introvert, anxious, pessimistic. The strength of nervous temperament, that is very punctual with appointment, well prepared before presentation. And weakness of the nervous temperament, that is tremendous anxiety, which lower down their potential, cannot take any changes in life. In short, temperament can use as a filter to arrive at final prescription. After incorporating the temperament, understanding of the patient is better manner, and how temperament helps homeopathic clinician. Phlegmatic, that is receiving case, sanguine, that is approach to the patient, melancholic, that is analysis of case, and choleric, that is final prescription. So thank you very much, madam, for your wonderful session. And study of temperament very nicely correlate with the understanding of materia medica in terms of the organon and repertory approach. So homeopathic concept, which has been very clear with your sessions today.
Thank you so much.
Thank you very much, madam. And now I invite Principal of the Parul Institute of Homeopathy and Research, respected Dr. Panda sir, to proceed with the vote of thanks. Over to Dr. Panda sir.
Thank you, Mehta sir, for giving me opportunity to produce the vote of thanks. We are very much thankful to Madam for her nice presentation. Temperament, that is a qualitative philosophical chapter which is very difficult for UG students, and some doubts always creates because of that topic itself. But Madam explain in such a manner with good examples and in story, that will be very appreciable. And this type of teaching must be there. Actually, the students always they are facing that how can you identify that particular temperament. So the way in which madam is expressed, that is very good and excellent way, and we hope the same cooperation in future also, madam. We are very much thankful to our management for giving this platform to share the knowledge of our teachers from different places of our country with our students and with our faculty. We are very much thankful again to all the principal of our constituent college, Dr. Mehta sir, Dr. Hina madam, then our dean sir, Dr. Purav Desai sir, and we are thankful our technical supporters, those who are supporting and for a nice uninterrupted presentation. And again, last but not least, we are very much thankful to all the audiences. Because of them, this program is going to be a success one. Again, I am very much thankful to you, madam, and hope the same cooperation in the future. Thank you.
Thank you very much.
So let us
Thank you, madam.
complete the.
Thank you, ma'am.
Thank you, sir. Thank you to all the esteemed faculty and to
Yeah,
parents.
ma'am, it was very interesting.
Yes.
I really appreciate it. It was very nice, ma'am.
Thank you so much, ma'am.
Thank you.
Maybe
So
I extended the time a little bit, but yes.
Yes. Okay, ma'am. Okay.
Thank you so much. Thank you, everybody. Thanks a lot.
Namaskar.
Yes.
Thank you,
Namaskar.
madam. Vishal.